What is substance use disorder? Substance use disorder occurs when a person's use of alcohol or another substance, for example, drugs, leads to health issues or problems at work, school, or home. This disorder is also called substance abuse. Okay, so what are the causes? The exact cause of substance use disorder is not known. A person's genes, the action of the drug, peer pressure, emotional distress, anxiety, depression, and environmental stress can all be factors. Many who develop a substance use problem have depression, attention deficit disorder, post-traumatic stress disorder, or another mental problem. A stressful or chaotic lifestyle and low self-esteem are also common. Children who grow up seeing their parents using drugs may have a high risk of developing substance use problems later in life for both environmental and genetic reasons. Okay? Commonly used substances include 1. Opiates and other narcotics are powerful painkillers that can cause drowsiness and sometimes intense feelings of well-being, elation, happiness, excitement, and joy. These include heroin, opium, codeine, and narcotic pain medicines that may be prescribed by a doctor or bought illegally. 2. Stimulants are drugs that stimulate the brain and nervous system. They include cocaine and amphetamines, such as drugs used to treat ADHD, for example, methylphenidate or Ritalin. A person can start needing higher amounts of these drugs over time to feel the same effect. Okay. The third commonly used substance, depressants. Depressants cause drowsiness and reduce anxiety. They include alcohol, barbiturates, benzodiazepines, for example, Valium, Ativan, Xanax, chloral hydrate, and paraldehyde. Using these substances can lead to addiction. Fourth commonly used substance, LSD, mescaline, psilocybin, mushrooms, and phenylcyclidine, also known as PCP or angel dust, can cause a person to see things that are not there, parentheses, hallucinations, and can lead to psychological addiction. Okay, the fifth, marijuana, for example, cannabis or hashish. Okay, moving on. There are several stages of drug use that may lead to addiction. Young people seem to move more quickly through the stages than do adults. Stages are experimental use, which typically involves peers, done for recreational use. The user may enjoy defying parents or other authority figures. That was experimental use. Now, regular use. Regular use. This is where the user misses more and more social or more and more school or work, worries about losing drug source, uses drugs to fix negative feelings, begins to stay away from friends and family, may change friends to those who are regular users, shows increased tolerance and ability to handle the drug. Okay, number 3. Problem or risky use. This is where the user loses any motivation, does not care about school or work, has obvious behavior changes. Thinking about drug use is more important than all other interests, including relationships. The user becomes secretive, may begin dealing drugs to help support habit. Use of other harder drugs may increase, and legal problems may increase. All right, the last stage, what is addiction? This is where they cannot face daily life without drugs. The nice problem, their physical condition gets worse, they have a loss of control over the use, and may become suicidal. Financial and legal problems get worse, may have broken ties with family members or friends. Okay, that was the causes. Now let's talk about the symptoms. Symptoms and behaviors of drug use may include confusion, continuing use of drugs even when health, work, or family are being harmed. Other symptoms include episodes of violence, hostility when confronted about the drug dependence, lack of control over drug use, being unable to stop or reduce alcohol intake. Other symptoms include making excuses to use drugs, missing work or school, or a decrease in performance. Need for daily or regular drug use to function. Neglecting to eat, not caring about physical appearance. No longer taking part in activities because of drug abuse. Secretive behavior to hide drug use, and using drugs even when alone. Okay. Now let's talk about drug tests. Drug tests, sometimes known as toxicology screens, on blood and urine. Urine samples can show many chemicals and drugs in the body. How sensitive the test is depends on the drug itself, when the drug was taken, and the testing laboratory. Blood tests are more likely to find a drug than urine tests, blood tests are more likely to find a drug than urine tests, although urine drug screens are done more often. Okay, let's talk about treatment. Substance use disorder is a serious condition and not easy to treat. The best care and treatment involves trained professionals. Treatment begins with recognizing the problem. Though denial is a common symptom of addiction, people who are addicted have far less denial if they are treated with empathy and respect, rather than told what to do or being confronted. The substance may either be slowly withdrawn or stopped abruptly. Support for physical and emotional symptoms, as well as staying drug-free, are also key to treatment. People with drug overdose may need emergency treatment in a hospital. The exact treatment depends on the drug used. Detoxification, parentheses detox, is the withdrawal of the substance abruptly in an environment where there is good support. Detoxification can be done on an inpatient or outpatient basis. At times, another drug with a similar action or effect on the body is taken as the dose is slowly decreased to reduce the side effects and risks of withdrawal. For example, narcotic addiction, methadone, or similar drugs may be used to prevent withdrawal and continued use. Residential treatment programs monitor and address possible withdrawal symptoms and behaviors. These programs use techniques to get users to recognize their behaviors and learn how not to go back to using, parentheses relapse. If the person also has depression or another mental health disorder, it should be treated. In many cases, a person starts using drugs to try to self-treat mental illness. Okay, now let's talk about support groups. Many support groups are available in the community. They include Narcotics Anonymous, that's na.org, Alateen, that's al-anon.org. And most of these groups follow this 12-step program used in Alcoholics Anonymous. SmartRecovery.org and LifeRing.org are programs that do not use the 12-step approach. You can find other support groups on the internet. Okay, that was support groups. Now, outlook, parentheses, prognosis. Substance use may lead to a fatal overdose. Some people start taking the substances again, parentheses, relapse after they have stopped. Complications of substance use include depression, cancer, for example, mouth and stomach cancer are linked to alcohol use, abuse, and dependence, infection with HIV or hepatitis B or C through shared needles, loss of job, problems with memory and concentration, for example, hallucinogen use, including marijuana, problems with the law, relationship breakup, unsafe sexual practices, which may result in unwanted pregnancies, sexually transmitted diseases, HIV, or viral hepatitis. Okay, now let's talk about when we need to contact a medical professional. Call for an appointment with your healthcare provider if you or a family member is using a substance and wants to stop. Also call if you have been cut off from your drug supply and are at risk of withdrawal. Most employers offer referral services for their employees with substance use problems. If you or someone you know is thinking about suicide, call or text 988 or chat 988lifeline.org, or you can call 1-800-273-8255. The 988 Suicide and Crisis Lifeline provides free and confidential support 24/7, anytime, day or night. You can also call 911 or the local emergency number, or go to the hospital emergency room. Do not delay. If someone you know has attempted suicide, call 911 or the local emergency number right away. Do not leave the person alone even after you have called for help. Okay, prevention. Drug education programs can be helpful. Parents can have a strong influence on their children by teaching them about the harm of using substances. Okay? Now, alternative names for substance use disorder would be substance abuse, chemical abuse, drug addiction, dependence on drugs, illegal drug use, narcotics use, hallucinogen use. Okay, a variety of references can be found at medlineplus.gov. Source, Medline Plus, National Library of Medicine. Thank you for listening.